Hello, everyone. This is Heather Brown Campbell, founder and CEO of Body, Essence, and Soul, your health and wellness consultant. I'm a bachelor's prepared registered nurse with more than 22 years' experience working in the healthcare industry. And as a result, I started this company with the goal of equipping clients with tools and information to help them make improved decisions regarding their health and wellness. Today's video is video number 6, and I'm going to be reviewing the lab results that should be ordered prior to your physical. This way, when you are going to have those labs done and you find out that not all the appropriate labs are ordered, you can reach out to your doctor's office and advocate for yourself in order to get those additional labs ordered. That way you get the full picture of what's going on in your body. As I go through the labs, I'm not going to go through every line of lab results that come back with each category. I'll just highlight the key ones that are typically focused on. The first one is CBC with differential, also known as complete blood count with differential. The key highlights for that would be hemoglobin, hematocrit, white blood cell, and platelets. Hemoglobin is an iron-rich protein. That is what gives red blood cells their color. The function of this iron-rich protein called hemoglobin is to transport oxygen. If every time we inhale, the presence of the hemoglobin makes it possible to transport oxygen from the lungs to our tissue. It drops it off there, and the byproduct of respirations, aka waste product of respirations, would be carbon dioxide. The function of the hemoglobin is also to transport the carbon dioxide from the tissue out through the lungs by way of exhalation every time we exhale. So if the hemoglobin is low, as you can imagine, someone may have symptoms of tiredness, lethargy, having to rest all the time in between tasks, shortness of breath, because they don't have enough hemoglobin to transport the oxygen to their tissues. The next one would be hematocrit. Now, blood is made up of plasma and red blood cells. Hematocrit is the percentage of red blood cells in a volume of blood. So as you can imagine, if the hematocrit is low, the patient may have similar symptoms as highlighted regarding the low hemoglobin also. White blood cell count, that can be, like with all lab results, too high or too low. If it's too high, it usually means there's an infection happening somewhere, and the doctor will do the appropriate follow-up to dig deeper and be able to prescribe the appropriate treatment for that. If the white blood cell count is too low, the doctor usually has that lab work repeated, and if it continues to be low, the patient is usually referred to a hematologist to investigate further. The next lab result are platelets. Platelets makes it possible for our blood to clot in a timely fashion, so we do not bleed out. So as you can imagine, if your platelets are too low, that means you're not going to be clotting as quickly as you should be, and that can be problematic. So again, the doctor will do the appropriate follow-up, repeat testing, etc. that's needed. The next lab test is CMP, also known as Comprehensive Metabolic Panel. The key ones I'll focus on for that are the blood glucose, the electrolytes, kidney function, and liver enzymes. Now, the blood glucose that it shows you from that lab result is what your blood sugar was at that moment in time when your blood was drawn. The normal range for that is 60 to 99. Sometimes patients' lab results come back with their blood sugar being 102, 103, and usually you'll hear, oh, I didn't fast for that lab. So it's normal for the blood sugar to be a little bit high if someone did not fast 8 hours prior to their lab. Of course, if the blood sugar is like in the 150s, 200s, things of that nature, then the patient is probably already a diabetic, or the A1C needs to be checked out, which is one of the labs that should be checked for your physical, the A1C. So we'll get to that in a few moments. The next one is electrolytes. Now, if someone's been having, say, vomiting, diarrhea for a few days, or for whatever reason they've had no appetite, they've not been eating, their electrolytes are going to be low, okay? Vomiting and diarrhea does deplete the body of important electrolytes, and so in that case, they will be low. Those important electrolytes are sodium, potassium, calcium. Those are important electrolytes for the functioning of the heart and other organ systems. So it's really important to keep an eye on those. The next one would be kidney function, which includes 3 lab results, all included in the comprehensive metabolic panel. That's the BUN, also known as the blood urea nitrogen. There is the creatinine, and then the third test is the glomerular filtration rate, also known as the GFR. Now, blood urea nitrogen is a byproduct of protein metabolism, and creatinine is a byproduct, again, aka waste product of wear and tear of our muscles. So as you can imagine, because they are byproducts, they're supposed to be excreted from the body, and it gets excreted by way of the kidneys out through the urine. So if the blood urea nitrogen is elevated, that means the kidney is not doing its job when the blood is passing through the kidney. And that is problematic. The doctor will do the appropriate follow-up to see what's causing the blood urea nitrogen and or the creatinine to remain elevated. A lot of medications negatively impact kidney function. So you may find that the doctor may need to take the patient off a medication or lower a dose of a medication in order to mitigate that problem, the effect that it's having on the kidneys. Then the third one is the glomerular filtration rate. That is letting the doctor know how fast the kidney is, how fast the kidney is filtering the blood through. And that is measured in milliliters per minute. Ideally, it should be in the 100s. Anything less than 60 is problematic. The patient is said to be in kidney failure, and there are different stages of kidney failure. I won't go into that. That's for a separate video. But anything less than 60 for the glomerular filtration rate, aka GFR, is not ideal. And again, you should be having a conversation with your doctor, seeing what medication may be causing that. And I did address that in a prior video. The next one is liver enzymes. So there are 2 liver enzymes. There is alanine transaminase and there is aspartate transaminase. When those are elevated, there could be a number of things happening. It could be due to some medication. There are medications that cause the liver enzymes to be elevated. And also, or it could be due if someone is a regular consumer of alcoholic beverages and they consume a lot of it, that can cause elevated liver enzymes, which is basically the body saying it's time to make some changes with that consumption. So those are the key lab results that are typically identified for the comprehensive metabolic panel. The next lab would be the A1C. Another name for that is glycosylated hemoglobin. The normal range for A1C is anything less than 5.7. If someone's A1C is between 5.7 to 6.4, they're considered to be borderline diabetic. Ideally, you want to be less than 5.7, as mentioned before. The next labs that's ordered are the lipids, which includes total cholesterol, triglycerides, HDL, which is good cholesterol, and LDL, which is bad cholesterol. Again, that gives you a picture of the types of foods you've been eating. If you've been eating a lot of fatty foods, a lot of pasta, white floury stuff, definitely a lot of pasta and white floury stuff is going to cause your triglycerides to be elevated. The high fat foods, buttery foods, treats, cheesy foods, which is high fat, is going to cause your cholesterol to be elevated. It's going to cause your LDL to be elevated and your HDL to be less. So again, that gives you a picture so that you can make some changes to improve your health. The next level is vitamin D. Because of where we are, or people may be watching this video from other countries. Depending on where you are, if you're in a country where most of the year is wintry, and so you spend a lot of time indoors or you're not getting enough vitamin D from the sun, then you definitely want to have your vitamin D level checked for your physical to see if your levels are suboptimal or not, because it's important to maintain healthy teeth, healthy muscle, healthy bones. Okay? Alrighty, the next test is urinalysis. So with urinalysis, it checks several things. It checks the pH of your urine, which is a factor of the types of foods you have been eating. It also checks the specific gravity of your urine, which lets you know, are you drinking enough water? Not just fluids, but water. Unless you've been told to do so, unless you've been told to do otherwise by a doctor, you should be consuming 48 to 64 ounces of water within a 24-hour period. If you're not consuming enough water, your specific gravity in your urine is going to be higher, okay? And kidneys thrive on water, so you need to be drinking that water. Again, the caveat is if a doctor has told you to do otherwise, okay? The other things that are tested in the urine are nitrites. If the nitrites are present, then that's a sign that bacteria is present in the urinary tract, which implies that you may have a urinary tract infection. Your bilirubin level should not be elevated. That would be a sign of liver problems. If your urinalysis is positive for ketones and glucose, that could mean either your blood sugar is elevated or you are a diabetic. Okay, and the diabetes is uncontrolled. If there's protein showing up in your urine, that's a sign that the kidney is not functioning the way it should. Protein should not be showing up in your urine, so that's a sign of a kidney issue. And then if there's blood in the urine, it could be for women who are still menstruating. It could be that they gave the specimen at that time of the month. Or it could be that there's a problem with the kidney or there's blood in the urinary tract. At that point, the doctor would have you go for a repeat testing, and if it's continuing to show blood in the urine, he or she may order for you to have a CAT scan done. So those are the labs that should be typically ordered for your physical. Thyroid testing should typically start after age 35 and then every 5 years thereafter. If there's a strong family history of thyroid disorder or the patient is having symptoms, then the doctor is going to be checking thyroid levels probably every year, if not every 6 months, to see if treatment with the medication has been effective, etc. Okay? Hope this information was helpful. Thank you so much for watching. Be sure to like and subscribe to my channel. And if you're interested in signing up for my services or getting more information, check out the contact information that you'll find in the description below. Thanks again for watching, and until then, make a commitment to stay healthy in your body, your essence, and your soul. Bye for now.